You might have heard the word immunotherapy. Now, cancers are not treated in similar way. Only chemotherapy is not the option to treat the cancers. So we have chemotherapy, conventional chemotherapy, protein-bound chemotherapy, targeted therapy, and we also have immunotherapy. Immunotherapy has also revolutionized the treatment of cancer in a big way. Now, what is immunotherapy? My dear friends, immunotherapy is just an injection. It's an injection, okay? It's an injection. What it does when it is given in the body of the cancer patient. So then what happens? It boosts the patient's own immune system. It boosts the patient's own T cells, the immunity cells. The numbers are increased and efficiency of those immunity cells is increased. So now these immunity cells will be able to kill the cancer cells, which otherwise they would not do, because there is something called as capping. They are hidden. The cancer cells are very smart. They develop a helmet, they develop a cap around them, so our T cells are not able to see them and fight. So unless our immunity cells see the cancer cells and recognize them, they cannot kill. So these immunotherapy agents are usually called as the PD-1 blockers or the PD-L1 blockers. These are the drugs which help to remove this cap from the cancer cell, and now our immune cells can see the cancer cell and kill it. So not only our immune cells are increased, the T cell number is increased, but also their efficiency to kill the cancer cells also increases after immunotherapy. So immunotherapy definitely works in a different way. You see, immunotherapy is not directly killing the cancer cell, it is making use of the patient's own body's T cells, that is immunity cell, to kill the cancer cells. So we are enhancing our immunity to kill the cancer in the body. Now, immunotherapy definitely is a different type of medicine. Therefore, side effects are not like the chemotherapy, the conventional chemotherapy side effects. The side effects are a little different. Now, why are the side effects happening in immunotherapy? Because the number of T cells are increased. Now, you know that anything in excess is bad. So definitely when the number of T cells are increased in the body also can lead to certain problems. Not for all patients, to a certain percentage, 5 to 10%. Now, what can happen? What are the side effects? So in immunotherapy, usually when the numbers are increased, these excess T cells can also go and infiltrate the normal organs in the body. For example, if these excess T cells are going and infiltrating the lungs of the patient can develop pneumonia-like features. So it can resemble like an infection of the lung. It's called pneumonitis. So immunotherapy-induced pneumonitis can happen, or sometimes immunotherapy can cause thyroid problems, endocrine problems, because if it's infiltrating the thyroid or the endocrine glands in the body, it can cause those organ dysfunction. It can also go and infiltrate the liver, and liver inflammation can be seen in the blood test. So these are the certain side effects, but the incidence of side effects in immunotherapy is less. It's generally considered a safer option, especially for the elderly, where giving chemotherapy will be challenging above 70-75. Immunotherapy, if it is there in the standard guideline for the patient, immunotherapy can be considered over chemotherapy. Sometimes we do combine chemotherapy along with the immunotherapy, again with the intent of increasing the response. So when we combine both the modalities, the response to the treatment increases. So here 2 plus 2 becomes 20, 2 plus 2 is not 4. So this is how the treatment response magically improves. So immunotherapy definitely is a different type of option to treat cancer. It's a safer option, and it uses body's own immunity cells to kill the cancer cells. Definitely this option is a welcome step in the oncology field, and I hope this video has cleared you a lot of doubts. If you have any doubt regarding immunotherapy, please mention in the comment section and I'll come back to you with that. Thanks a lot.